Hey. What's your neck, mate? You might have whiplash.
That prick rear-ended me.
Hey, look, you're going to want to see a guy named Dwayne. He's the best mechanic in town. I'll give you his number.
Look, I really got to go now. Okay, you two. Wait. What do you need?
The doctor.
Morning.
Close enough.
Riker Reeves, 21, found unconscious in the university car park. Black eye, split lip, and pretty significant soft tissue damage to his left ear.
If you feel all right, do you think you could slide across this bit for me?
My laptop, did they take it?
I'll see, but let's just get you checked out first.
So we're going to have to raise the bed up, take a good look at that ear.
You just grow up, the pair of you.
He's faking it. Look at him. Oh, bloody Oscar.
Just settle down.
It's okay. You're okay.
Sorry, I just feel like I could punch a hole in the wall.
Well, that'll be good, gentlemen. Do you know what happened?
Bunch of guys. You know?
Some people really suck, huh?
Riker Reeves, what are we going to do with you? Well, if you're going to go out picking fights, you'll have to put up with me assessing you. All right, send him to radiology, CT head.
Hey, it's okay. I'll take you.
Yeah, it's important to look for any significant bleeding or exudate.
Can I ask you something?
You just did.
Right, I'm just wondering, what did Drew let you do when you first started?
The usual. Some biggies. Got to do a Whipple's procedure.
That's amazing.
Well, I had been 5 years in the game at that point.
Yeah, of course. And this is great too.
Yep, you're done.
Is that comfortable, Miss Jennings?
Yes.
Drew never lets me get my hands dirty. I mean, not dirty, you know, I mean like hands-on practical
I know
stuff.
what you mean. But I don't know if redressing a post-op ulcer is hands-on. We'll be back soon, Mrs. Jennings.
Thank you. I totally get you. And Drew's actually let me observe a few really interesting procedures.
So you haven't assisted on an operation yet?
Micromanager McCaskill, you know what he's like.
You're lucky to have him. He had my back, and he actually gave me a lot of opportunities early on.
Yeah,
You're still a junior registrar, there's no rush.
I totally get you. You're right. I'll get there.
Running around so much.
All right, so no bleeds, no facial fractures.
Good news.
But you do have a contusion to your gallbladder and trauma perf to the eardrum.
Does that mean?
Yeah, it's not good, but we'll get you up to surgical, won't we, Clover? You know, if someone did this to me, I wouldn't be trying to protect them.
He doesn't know who did it, Emmett.
Yeah, that's good. Go ahead.
We need psych down here.
Christ on my bike, Clover.
Maeve, don't you think Riker could use psych services after what happened, don't you think?
Well, I don't know what happened.
He's been beaten up.
Psych, sure, but can we move it along? Because 2 staff to 1 patient isn't going to clear the decks.
So can we get him up to surgical? Now?
That's Hitchings, wart removal, elective, Miss Lineker, Explorer.
Can you stop that whispering?
Sorry?
What are you, meditating?
No, I'm a kinesthetic learner, so
I know what kinesthetic means.
Right. It just might mean Drew trust me, you know, give me a go like he did with you.
Yeah, he's not going to do that.
Well, I'm open to your ideas, you know, woman to woman.
Next stop, Helen. We need to insert a chest drain.
We?
What is the triangle of safety?
The interior border.
What are you doing? You were supposed to meet me?
Hey, give her a break.
I'm sorry, I should have been there.
I'm heading to theatre. Tympanoplasty.
Okay, great.
Actually, Scrubs, I've changed my mind. You can just stay here.
Dr. Gaskell, I feel like I'm ready to assist you in theatre.
Not today.
Just no?
Next time, you be where you're supposed to be.
Okay.
Are you sure there isn't anyone I could call?
All right, Riker, should we go?
You'll be so fine.
Okay, Emma, that pain relief should start kicking in soon. Mild abdo pain, she's had it since this morning. So we do a bloods, urine sample and review, correct? You're okay?
Yeah, I'm going to need those bloods and urine in the next 10 minutes.
Sure, but I've got Mr. Jackson waiting and then I need to review Mr. Parker's
Just figure it out.
Sage,
How can I help?
I don't think I've ever seen you miss a vein. My patient's arms look like pincushions by the time I'm done with them. And Emma over there's already freaking.
She seems okay.
She hides it well.
I could do a bloods, but I don't have time to do anything else.
You're a legend. She also needs a urine sample. Thanking you.
Nice of you.
Yeah, well, unlike you, I'm happy to help.
Great.